Psychedelics are drugs that cause hallucinogenic and euphoric feelings. They're a very sensitive topic, especially for someone to talk about in a classroom setting. But I think the reason they're touchy is deeper than the drugs themselves. Psilocybin, the active ingredient in magic mushrooms, and LSD are the most popular psychedelic drugs in America. They're illegal, and I'm not here to say that they should be legal, but I feel like they are looked at poorly when there may be excellent uses for these drugs. In the boom of psychedelics during the 70s, ads and big companies began to spread rumors that the psychedelic drugs were killing people at an alarming rate, which they weren't, and this quickly made people hate the drug. It became infamous, it became a hippie drug, and it was no longer looked at the same way. In the early 50s, MK Ultra began experimentation with psychedelics, but not for people's health, for war tactics during the Cold War. They looked at mind control and altering states of mind using these drugs to help them get political gain and other things. The health studies came to a halt in 1970 when the Controlled Substance Act made it impossible to get your hands on LSD. Today's research, however, shows that psychedelics can have a wide array of positive effects. Microdosing is a type of psychedelic treatment without the trip. They give you an amount of LSD or psilocybin that does not pass the threshold for hallucinogens, and it increases creativity and can relieve anxiety. It's also popular in people who have depression because it increases energy levels and it can increase problem-solving skills. But microdosing is obviously not the only way that people use psychedelics. The trip is another huge part. It has more positive effects even than microdosing. It helps people to look at their problems in a different light instead of pushing them down like other drugs do, like anxiety medicine, depression medicine. When you go on a trip, you may get to look at your issues differently. You get to attack your anxiety in a different way. You might find a way to stop your anxiety attacks or to get yourself out of a funk of depression. If you don't believe me, a recent study at Johns Hopkins showed that 80% of cigarette smokers were nicotine-free after 6 months and 2 to 3 psychedelic trips. So they tested it on alcoholics, cocaine addicts, and all showed results. But the people who came in for cigarette smoking left, 80% of them were nicotine-free. And it comes down to the mental state you have when you go into the study. So if you go into it and they give you presentations on cigarette smoking, why you should quit, and you have a goal for yourself when you go in, these psychedelic drugs are repaving the brains of these people, and they're finding out that they can overcome these things after these trips. I do not at all hope that after hearing what I have said, you go out and you do drugs and psychedelics, because it's illegal and they're not for everybody, and very bad things can happen. But in a healthy environment with professionals, I do believe that this may be the medicine for certain people that have looked and can't find the depression medicine for them, the anxiety medicine for them, maybe people that need more creativity. I feel like this may be a huge key in checking boxes of patients that can't find what's right for them. Thank you.